and welcome to our special show, Coronavirus, Fact versus Myth. I'm Gargi Rawat. On this show, we'll bring you all the latest on the pandemic and also tell you about the fake news you need to watch out for. Coming up ahead on our show, our newsmaker today, we're joined by Dr. Saad B. Omer, Director, Yale Institute for Global Health. Well, let's take a look at the headlines and top stories today on the show. Well, the big focus on the show today, since the pandemic began, one of the terms that's been constantly used has been herd immunity. That is the point at which the virus can no longer spread widely because there are not enough vulnerable humans left. Now, scientists have suggested that perhaps 70% of a given population must be immune, ideally through vaccination for herd immunity to be achieved. But now some researchers are saying that the threshold is likely to be much lower. It could even be just 50%, even perhaps less than that. Well, to talk more about herd immunity and the vaccine, we're now joined by Dr. Saad B. Omer, Director, Yale Institute for Global Health. Thank you so much for joining us, Doctor. Now, this herd immunity that's been constantly spoken of since the pandemic began, you recently said that it could vary actually from group to group. Could you explain that? Because it could also mean that herd immunity is a lot closer than we think.
So look, we've always known, and some of us who have worked on it in the context of vaccines have said that for a while, that herd immunity is heterogeneous. It depends from population to population, depending on their interactions with each other and outside groups, and also their disease exposure. Having said that, so that will be there, and it will be that heterogeneity manifests as the overall number that may vary from the initial crude estimate. But having said that, it is the other part of this is that using infection-derived herd immunity is still not an optimal strategy. The way to achieve herd immunity is through vaccination. So the idea is that we may have to sort of vaccinate people in large numbers still in order to have meaningful and sustainable control of this disease.
All right. Now, speaking of the vaccine, how hopeful are you about the vaccine coming sooner rather than later?
Yeah, so I think the indications are good that we will have a vaccine. And here's the reason why, because the earlier data are encouraging, but also that there are multiple strategies that are being tried. So that hedges our bets, and the risk is spread out. So based on that, the hope is that there will be a vaccine in a reasonable period of time. Is it in the next few months? There's still some uncertainty. The signs, the timeline of large trials indicate that at least for the first few products that are are ahead of all the other products, we will have trial results. So this would give us an answer whether to move forward with these first line of vaccines that is being tested. Unfortunately, if it doesn't pan out, so that's why we do these trials to look at the data. If the data don't pan out, then we'll have to go to other, second line of vaccines that are being there. So second line is just based on the timeline. It's not necessarily that they are inferior. It's based on the timeline. So there is some uncertainty around the immediate short term of the timeline, but the signs look good that we will have a vaccine in the near future.
All right. So, and when you say the near future, what is your estimate? What is the timeline you're viewing?
So, look, the central estimate that I have, based on the public information I have seen, is still early spring in the northern hemisphere. Obviously, the early spring of 2021 is where we'll have a reasonable vaccine. It could be a little earlier and it could be a bit later than that. But my central estimate is that. The hope is, like everyone else, that it would be a little bit earlier.
All right. Now, there's also been a lot of discussion over a possible reinfection after you get coronavirus and how long the antibodies last.
I can tell you that it's an emerging area and the data is coming from all sorts of places and the data are not settled yet. So we know from other coronaviruses that there is some immunity. In some of them, it lasts for a few years, etc. But for this one, I think we'll have to wait and see for some real concrete evidence of the how long it actually lasts. And so we should remember that we are in August, and the real numbers in sort of this virus started taking off in January, February, even though it was sort of reported by China to WHO in late December. Obviously, the number of cases in high numbers started appearing around that time, from January to March and April. And so therefore, people who developed the initial cases, not enough time has passed for us to be able to say a lot of this stuff definitively. But there is mixed data out there, and I would hold my judgment in terms of the longevity of protection.
All right, now it's going to be very challenging going forward. The virus is spreading more and more people are being infected. What are your worries?
So yeah, the challenges are that, first of all, having an evidence-based strategy to control in the interim as vaccines come about. My biggest concern as a vaccine researcher, for example, what keeps me up at night is the fact that the world has never vaccinated adult populations in the numbers and the proportions that we would need to vaccinate to have sustainable control over this virus. And most countries, including the US and a lot of other countries, seem to be unprepared for that level of an adult vaccination program. So if you think about it, countries do a pretty good job. India has done a pretty good job of vaccinating children. Obviously, there's heterogeneity by state and region, but overall, it's a pretty good, reasonable vaccine delivery system. Adult vaccination is a new beast for most of the world. And my concern is that countries are not preparing for the logistics, for the acceptance, for the delivery, for the last mile, for the refrigeration capacity, for the supply chain capacity, and for the cold chain capacity, and so on and so forth, that would be required to deliver this vaccine to adults. So that's what countries should be doing, and that's what's keeping me up at night.
All right. Well, thank you so much, Dr. Umair, for speaking to us here at NDTV.
My pleasure.
Thank you for that. Well, the other big focus on the show today, the second Sero survey has been conducted by the Delhi government across Delhi. This was for the first week of August, and it's revealed that nearly a third of Delhi's population, or 29.1%, has been infected with COVID and has developed antibodies. For the survey, around 15,000 samples were collected. The Sero survey was conducted to detect the extent of the population that's been exposed to the disease. So nearly a third of Delhi's population has antibodies, is what has been revealed today by the Home Minister. Now, to talk more about this, we're joined by Dr. Yatin Mehta, Chairman, Institute of Critical Care in Medanta. And Dr. Mehta, now in the last Sero survey, it was revealed that 23% of Delhi had antibodies. Now it's increased to 29%. So a 6% increase. Are you surprised at that?
Not at all, Gargi. First of all, congratulations. You people do your homework before you come on the show. So 23% to 29% is a 6% increase, right, which I am not surprised by, because if you look at the statistics, we see it every time on every news channel how the numbers are going up in Delhi, but that is not unexpected. In fact, it is less than what I would have expected. But what bothers me about this are two things. One is 50% of the patients were of the age group, I think 18 to 50, 20 to 50, and only 25% were over the age of 50. Now, the elderly population, we all know, are more at risk of developing serious disease and mortality, dying also. So, only 25% of the population in this 15,000 survey were over the age of 50. So, I would have been happier if there were a larger percentage in that age group. Secondly, what bothers me about this survey, which what worries me a bit, is that in South Delhi, the increase has been up to 50 to 60% in certain areas. Now, earlier, one of the explanations given of why it was spreading so much was not only the virus was infectious, but also in close environment, when too many people are in congested environment, very close to each other, social distancing is not possible, common toilets are used, for instance, in Dharavi and things like that, or in poorer East Delhi areas of Delhi, the spread would be more, and it was more. Now, these are the South Delhi areas which are a little more educated, more upper class areas, where there's enough of space in the house, there are enough toilets, people are not sharing too much of space, they can safely maintain social distancing, and still the incidence has increased by 50 to 60%. So that is what is worrying. That means we are not taking enough, this particular group of people are not taking enough precautions. Because if you have social distancing, masking and gloving and hand hygiene, this should not have happened. Also, in most of many areas of South Delhi, one last point, that the elderly population is more because many of these children have been educated and they have gone abroad. So the population, if you look at in defense colony, for instance, elderly population is more, who are more at risk. So if the spread is so much, that is a bit worrying.
All right. And Dr. Mehta, also, it had been thought that, the situation in Delhi has steadied. Of course, it's not the crisis that we saw earlier. And what do you think this tells us about possible herd immunity? Will some areas now have a maximum number of cases or a huge number of cases? And because of that, perhaps there is some sort of herd immunity developing. What would you say on that?
See, by definition, the herd immunity is when the 70% of the population has acquired the antibodies or immunity to the so-called temporary immunity. The definition can vary a little bit, percentage can vary a bit, but the price to pay would be too high if we achieve herd immunity at the expense of getting disease.
Sure. Because
the mortality would be high. But as rightly said by the previous speaker, if the herd immunity is achieved because of vaccination, then that is the way to go, not by getting the disease.
All right. And finally, any worries regarding the Delhi situation right now? Or do you feel that it's more in control?
No, it seems all right. I'm getting less patients also from Delhi now. We are getting more from the neighboring states.
Sure.
So that is something to be happy about. But still, I would think that it has opened up too much. When I travel from Gurgaon to Delhi, I see Delhi is like normalizing. So I think we should, exercise the discipline which is required to contain the spread of the disease in the community.
Absolutely. All right, Dr. Mehta, thank you so much for that, and do stay on for our viewer question segment. But before that, we'll take a look at Europe now and we'll look at Spain particularly. Now, the graph of Spain's daily COVID case count is taking on an emphatic U shape with 3,750 new infections being reported in 24-hour period, joining Germany and France in reporting the most cases since lockdowns helped Europe quash the initial wave of the COVID pandemic months ago. Well, to talk more about what we're seeing in Spain, we're joined by Enrique Lopez, a Deputy Chief Editor of Telemadrid News. Thank you so much for speaking to us. So, what are the reasons that you're seeing what is being called a resurgence or a second wave in Spain?
Okay, so Spain is getting that high number of positive cases. We don't know exactly the reason. Now all the efforts are concentrated in young people. Before it was old people, but now young people seems to be less responsible. So our country is taking many campaigns for the young people to get to know what they can do or what they cannot do. And they are implementing measures as you now cannot smoke on the streets. So from this week it's forbidden to smoke on the streets. There are other measures are discos, pubs and bars, they close now at 1:30 in the night, so young people mainly cannot concentrate there. And also there are different measures for people in beaches. They are closing beaches also during the night, so they cannot concentrate many young people, which seems to be now the main reason for these higher numbers of COVID.
All right, so the young people they're being held responsible for the surge in cases. Also, the thing that all countries are struggling with is when to open schools, whether to open them at all. What is the thought there in Spain?
That's a good question, because here we are on holidays, so schools are closed, and they are supposed to start in the beginning of September. For the moment, there are no instruction for how to do it. They don't know how to do it. In Europe, other countries as Germany, they have a start. Here, they are planning different measures, but for the moment, We don't know exactly what is going to happen. They say like small classes only with kids that they don't mix with other kids. They say also to keep the kids in the house, and not going to the school. But for the moment, we don't know because every day more people is saying a second wave is coming. So we don't know if we will have to be again keeping the houses.
All right. Well, thank you so much, Mr. Lopez, for speaking to us. And worries in Spain of another lockdown coming. Well, with that, time for us to slip into a short break. Coming up on the other side, our viewer question segment, and we're joined again by Dr. Yatin Mehta. Welcome back. It's time now for our viewer question segment, and to take those questions, we have with us Dr. Yatin Mehta, Chairman, Institute of Critical Care in Medanta. Thank you, Doctor, for staying on with us. And the first question we have is from Kochi. Let's play out that question.
Which said that a study suggests that rashes could be a symptom of COVID-19. So, I mean, normally you wouldn't go to a hospital when you have rashes. So how do we know when to consult a doctor or go to a hospital, since everybody is reluctant to do that in this situation?
Doctor?
Yeah, that's a good question. Rashes are not that common, fortunately. But anyway, if you develop rashes when you not had it earlier, that means forget about COVID. You have probably some either allergic or some viral infection or some allergy. So you need to show it to a doctor. Nowadays, in most of the good hospitals, you have video consulting which is available. So initially, you need to show to either a physician or a dermatologist, and then you go from there. But rashes are not that common. It can happen otherwise.
But are COVID rashes, is there something very particular about them, some special characteristic that one can look out for?
No, it is more of a reticuliform rashes, but it is not very common. But also it's not really a diagnostic rash, which doesn't happen in other diseases. So really not the main thing.
All right. Though it is found to be, in some patients, a lot of them do talk about having rashes. We have another question from Kolkata. Let's play out that question.
Hello, I'm Pallvi, and my question to you is, a few people I know have been tested positive while they had almost no symptoms and hardly a fever that was even a minor fever and not a very severe one. So how is one supposed to identify if they have COVID or they do not have COVID? Because there are almost no symptoms.
All right, doctor, that I think something a lot of people are facing. You don't know when do you go for that test for coronavirus?
See, one must not forget during these times that there are other diseases also. Other infective diseases also which are happening at this time. So corona is not the only disease.
Sure.
Fortunately, 80% of the patients have low symptoms or a mild disease, or many of them are asymptomatic. If there is asymptomatic, there is no question of testing. However, why should you get yourself tested if you have no symptoms? But if you are mildly symptomatic, but classically what you find in most of the patients that you'll have some low-grade fever, cough, and sore throat. Sore throat with the change of voice is very common. So if these things are there, in these particular times, it's a good idea to get yourself
But you may also want to get yourself tested if you have, elderly parents in your house or if you have young children, isn't it?
See, Gargi, at the moment, ICMR is not recommending that. Okay, at the moment, the recommendation is only in symptomatic people. Not if you yourself go, you have no symptoms and you want to get yourself tested. That is not permissible.
All right. Well, okay. Thank you so much, Dr. Mehta, for taking time out and answering all those questions for us. And finally, we have our COVID warriors. These are COVID heroes in Assam, where at least 60 Jawans from the Indian Army have volunteered to donate plasma to save lives of critical COVID patients, many of them defending the country in forward areas, protecting the nation, and also helping save lives. So COVID heroes there. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.